I'm receiving workman's comp for a back injury that I received at work, and I'm not being taken care of by my doctor. He's also the chief of staff at the place that I work at, so he makes a lot of decisions and stuff. Well, he took me off of work and then wound up putting me back at work 3 weeks later. And I worked one day, and then he took me off of work again. I then had an injection done in my back, and I was sent over to Salina Regional for pain care. Well, they wound up giving me a medicine that almost killed me, and it was an opiate blocker, and I was on narcotics, and it totally cut off everything that was in my system, and I had to be hospitalized, and now I'm having to be on blood pressure medicine.
Wow.
It's just been one thing after another. With workman's comp, they're not answering any phone calls from me. I'm having problems with Salina Regional, and that whole episode, because now the hospital in Abilene is going after them for having to hospitalize me and get my levels back in my system.
Have you seen a specialist for this problem?
No, I was sent to go have an injection done, and I had one injection done so far, and then I'm supposed to go back tomorrow for another injection. Then I'm supposed to go see another specialist, Dr. Mongulu, who's a neurosurgeon.
Right.
But they couldn't get me until March 25th.
Yeah.
The doctor is wanting to take me off my medicine and pretty much, I guess, send me back to work. But I have a herniated disc, I have a bulging disc, and I have a ruptured disc.
Wow.
And I'm just not getting the proper care from my workman's comp doctor. I don't know what I'm supposed to do because, like I said, I'm not able to get a hold of anybody, workman's comp. Salina Regional, almost killing me. And so now I'm, petrified to even go to an emergency room to get pain medicine.
Well, the first thing I would say to you, Christine, is that when you have your employer providing your medical attention, specifically a healthcare provider is who you're working for, and that healthcare provider is also the doctor that's providing you the workers' compensation medicine or medical care, that's a problem. In my humble opinion, that's a conflict of interest, and that should never happen. Whenever I see that happen with a new claim coming into my office, I tell the folks that I'm representing that we're going to do everything in our power to get you away from that doctor because that doctor has a conflict of interest in seeing your workers' compensation claim come to a quick close, a successful close from an employer's perspective. So that's the first problem that I see. Secondly, you need to understand that if there was or were adverse reactions to the injections that you had, that is part of the workers' compensation claim, and you must make the workers' compensation insurance carrier pay for that. If they caused you additional injury from their applications of injections or medicine, so forth, they are responsible for paying for the medical care to get that taken care of. Lastly, waiting almost 2 months to go to a back specialist. I understand you're in a smaller community, but there are plenty of back doctors throughout the state that will handle workers' compensation claims that are competent, and you shouldn't, with the serious types of injuries that you have, you shouldn't wait. They shouldn't force you to wait, and this type of conduct is typical when the employer is basically trying to stonewall you or keep you from getting all of the benefits that you're entitled to under the workers' compensation system. The obvious point here is that you need a workers' compensation lawyer who needs to cut these things out, make these things stop happening. How you're being treated is not right, and that needs to change, and so you need to get a work comp lawyer right away.